think everyone will experience some degree of addiction in their life, but many people who suffer opioid addiction never overcome that. There's a well-known woman that comes to one of the clinics I rotate through who brings down a prescription for opioids, and even though it clearly states do not fill until a certain date, she'll call us continuously, harass us, and even show up in the clinic trying to get them filled. I happen to be working the morning of her available refill date, and as I roll up the blinds, she's sitting in our drive-thru just staring through the window. So she watches me as I count out her pills, have the pharmacist verify them, and as I ring them up. And then she also makes sure that there's a $0 copay because paying $3 is ridiculous, and she's not going to do that. I currently work as a pharmacy technician, so I deal a lot with patients, doctors, and the pharmacists when it comes to opioid dispensation. I'm also pursuing pharmacy, so learning about opioid abuse and how to prevent abuse is very important for the integrity of my career. Even if you've never taken an opioid drug in your life, Brady Dennis of the Washington Post says that over 59% of Americans over the age of 20 actually take prescription drugs, so that may be you one of these days, even if it's not an opioid prescription. So first we'll look at what an opioid is, and then we'll look at how the United States is responding to this abuse. Merriam-Webster defines opioids as possessing some properties characteristic of opiate narcotics, but they're not opium-derived, which means the receptors on your nerves will still bind to and receive these molecules to transmit messages to relieve pain and cause a high in your body, but abnormal messages are actually sent. And even though the chemical structures mimic your natural neurotransmitters, dopamine is produced instead of the beta endorphins, so your body recognizes it as not natural, and the National Alliance for Advocates for Buprenorphine Treatment actually believes that this is how the reward circuit starts, because your body realizes this isn't a natural reaction, but the pills are pleasurable. Opioids can be illicit, such as heroin, or illicit, such as hydrocodone, oxycodone, or some of the other common names you've heard. In pharmacies, they're classified as controls, and they get the highest priority when it comes to inventory. Pharmacy technicians cannot process orders or return orders of opioids. It has to go straight to the pharmacist where they sign off on it. If you're getting a prescription for opioids, you must have a hard copy of that prescription with a handwritten signature. We don't take e-signatures, faxes, or any e-prescription sort of things for opioids. And then when it's time to count, pharmacy technicians first count out the pills for the patient, record that number, we count out what's left on the shelf and in the bottle, record that, and then we sign our name and date it in case an audit comes up later and there's a question regarding how many pills are left in stock. So now that you know what an opioid is, we can see what the abuse leads to. Overprescription actually began in the late 1990s, according to the National Institute on Drug Abuse, when pharmacies were misinformed that opioids were not addictive to the patients that were taking them. So doctors began overprescribing these opioids for pain relief because it was a quick fix and pretty cheap when insurances covered the copays. However, because of this, in 2014, the National Survey on Drug Use and Health said that 21.5 million Americans over the age of 12 actually battled substance abuse. This overprescription also leads to patients finding better or stronger highs in opioids such as heroin, and depending on where they get them, it's cheaper and easier to access than a prescription for an opioid such as oxycodone. The Centers for Disease Control and Prevention said that in June of 2017, 91 Americans actually died a day because of opioid abuse, and this had a lot to do with the overprescription that started and the addictions that led to heroin abuse. So as you can see, opioid abuse can be very dangerous, so the United States is trying to monitor and reduce this abuse that occurs. Tamper-resistant drugs have been manufactured, which are harder to snort, crush, or inject, so when a patient takes them, they don't get that immediate high that they originally would. However, the downside to this is that insurances may not cover these more expensive brands, so their copay will be a little bit higher, which patients really do not like. So some of them feel that they're forced to look for cheaper options, such as, I said, heroin in the black market. Another way that the United States has been trying to monitor this abuse is through online databases where doctors and pharmacists can actually look at a patient's history and see who's been prescribing their opioids, where they've been getting them filled, how many and what dates they've been getting them filled. This prevents what Vestal calls doctor shopping, where patients actually kind of trick doctors into giving them multiple hard copies of drug prescriptions, and then they'll trick different different pharmacies within their city to fill those. Jay Kim, a pharmacist I actually work with, recently stopped a drug cartel from dispensing through one of our Columbia pharmacies. Thanks to his ethical obligations, he was checking the database and saw a few red flags, so he refused to dispense, and he later found out that they were under investigation for selling these opioids that they were getting throughout Columbia. As you can see, opioid addiction is a constant battle in the United States. Addicts do what they can to bend these rules, but I hope to be a key player in preventing opioid abuse in the future.